Imagine a grandparent who's been diagnosed with metastatic colorectal cancer, or a grandparent who's been diagnosed with primary liver cancer. Imagine that patient having to receive radiotherapy that might damage some of their organs, or receive chemotherapy that makes them very, very unwell. We're developing solutions that will selectively treat some tumors from inside the tumor, ameliorating the condition so those grandparents don't have to feel some of those long-term effects, those systemic effects, and they can have outpatient procedures where they're feeling really, really very well, getting an improved quality of life by using glass technologies. My name is Dr. Daniel Boyd, and I'm an associate professor at the Faculty of Dentistry at Dalhousie University. So I came to Dal because I had the opportunity to work in a clinical faculty, which as a material scientist is a fantastic opportunity. So some of the technologies we're working on at Dalhousie right now are platform technologies. We're trying to build multifunctional materials that can satisfy several clinical requirements. What we're trying to do is drive brand new technology solutions that will push the boundaries of what is possible. So it may very well be possible to eliminate lots and lots of the side effects and complications that come from conventional therapies by deploying glass materials in a very standardized, personalized, and optimized way to take care of every patient on a patient-to-patient basis. We've made synthetic bone graft materials in the lab that have been shown to accelerate bone healing at a rate quicker than anything that has been previously reported in the literature. So the work we're doing in liver cancer in the Biomaterials group at Dalhousie, we're making soluble microspheres that can be loaded with drugs so that they can be implanted inside a tumor and subsequently release those drugs inside the tumor so that the patient is delivering or receiving very localized chemotherapy at the site where it's needed most. When I sat with my dean and I explained to him that we needed some of this infrastructure, the first place he said we needed to speak to was DMRF. He wanted to speak to DMRF to let them know the work we were doing in dentistry so that DMRF could help us tell our story about the breakthrough technologies that we're developing so that we could work together to build the case to advance some of these technologies quicker than we could if we didn't have DMRF. I think philanthropy is hugely important for research. For me, it's a speed to execution. The value of philanthropy is that we get to act on state-of-the-art information, discoveries that are happening by the minute. At that point in time, we can act on them and deliver and develop development plans to bring those technologies to patients quicker. We could shorten our execution timeline by about 2 years if we have philanthropic support for some of these ideas versus waiting on conventional funding cycles from government agencies. To the DMRF donors that do support medical research, I realize that sometimes it can take time, and I realize that sometimes it can happen really quickly, but I also realize it can't happen if we don't have your support.